Thank you for staying with us. The quality of health service largely depends on how equipped medical professionals are. In Nigeria, the foremost concerns of healthcare workers are improved incentives and welfare, the issue of poor and delayed salaries, and terrible working conditions. These concerns have led to incessant doctors' strikes in recent years, and many leaving the country for greener pastures. In 2022, the Nigerian Medical Association reported that over 10,000 Nigeria-trained doctors practiced in the UK, leaving or posing a threat or a great challenge to the already fragile healthcare system. In 2023 alone, at least 900 members of the Nigerian Association of Medical Doctors fled from Nigeria to Europe. The life-saving question one should then ask is when will the average Nigerian be relieved of additional headache of where to seek quality medical care? Joining us in the studio is the Chief Medical Director of Heritage Men's Clinic, Dr. Rasheed Abassi, to talk to us about this. Good morning.
Good morning.
It's good to have you join us.
Thank you.
Are you also witnessing the Japa Syndrome in your hospital?
Yes, it's affecting all of us. We have to go back to the roots of all this.
Absolutely.
This is not something about 5 years ago, 10 years ago. It actually started by about 4 decades ago.
Right.
In the 80s.
So back in the day, you japped, and then now you're back.
You were
back to the country.
Right?
So I left Nigeria as an engineer. I did not do medicine in Nigeria.
Wow.
Interesting.
Yes.
So what happened?
It was when I got to the United States, the opportunity presented itself, and then I ventured into medicine.
Wow.
All right, so let's go back to 4 decades ago when this began.
Yes, 4 decades ago, if we all remember, Nigerian doctors were the one that established Saudi Arabia healthcare system.
Right.
What did that leave us with? They drained our experts, and we never filled that vacuum. So what we're seeing now is cascading effects of that 4 decades ago. The Nigerian professors went to Saudi Arabia for greener pastures. A lot of them gave the excuse that it was for their family, better conditions. The Nigerian government never paid attention to that. And so now what we're seeing is actually more than the symptoms of what they did. They left our academic institutions. We could not fill that up. Our training institutions now, we are considered a medical desert.
Right.
We currently have more medical Nigerians living abroad than at home. Our current healthcare minister said we are left with 55,000 doctors.
Wow.
For a country of over 200 million.
Yeah, speaking of data, the NMA actually said now 24,000 doctors for over 200 million people. That's a doctor-to-patient ratio, which is far below the WHO recommendation.
Right.
And we have 11,000 Nigerian doctors registered in the UK that are working under General Medical Council. But how do you consider the impact, the long-term and the short-term impact? Or let's say short-term and then long-term impact of this mass exodus of these medical practitioners?
So the short term and the long term seems to be the same. We're dying. We're losing people. You go to the emergency room, the waiting time is just ridiculous. Our healthcare infrastructures are just devoid of the appropriate equipment. Our healthcare workers, the very few that are left, they're overworked. It's like you put them to the war front and you tie their hands. So who pays the price? We, the masses that end up in the general hospitals, pay the price. I get patients now that tell me they want to see a specialist and they're giving them 6 months, 9 months waiting period.
In Nigeria?
In Nigeria. In Lagos especially.
Something that needs urgency to of attention.
So let's look at how we have, as a country, tried to address the gaps that you mentioned over the years, both in our institutions and in the hospitals. We have seen strikes several times. We have seen doctors come to talk about their welfare not being anything to write about. And then we have seen recently a Proco doctor put out a video looking at the state of a primary health care. It's not something words can really describe as it is. Now, the condition on which they work is also a major challenge. Talk to us about government efforts, the various levels, subnational and the federal.
Good. About 10 years ago, 2015, the Nigerian government, in collaboration with stakeholders, investors, actually came up with a plan that how can we address this. Granted, they are 3 decades late, but let's look at what they've done. What they're trying to address is just the symptom rather than look at the roots of what happened. Everybody blamed the doctors and said they're traveling for greener pastures. Look, the grass can be greener anywhere. We just need to provide the nutrients. Are we giving them the right incentives to stay home? Because a lot of the doctors, my colleagues, will tell you, look, it's for my kids. The school system are better. So now it's not even medical. They're looking at other things because as parents, they want to make sure that their kids have better future, their kids go to good schools, the schools are not on strike, and it's overwhelming to them. Yes, at the burden end, we look, oh, they go there for better prices, but they actually go for their own professional improvement. If you go to the US, the incentives you have, we cannot be comparing that. But we can do a lot here. Because these Nigerian doctors who are thriving over there, look, what is the difference? If you incentivize them, they can do the same thing back home.
So what were we trying to do at the time? You wanted to talk to us about that, and what can we do to address it, if there's anything, really?
So let me give you an example that came to mind. The CBN just waived the registration fee for BDCs for this year. What are we doing for our medical professionals?
In terms of?
In terms of incentivizing them, in terms of their livelihood, in terms of their pay. Because on the list of conditions, people will tell you it's for the salary. But it's not only that. I'm in a situation where I want to expand. I'm a small business. American economy is run by 80% of small businesses. I have 15 employees. I'm trying to expand. You know what the banks are telling me? We have the money, but you have to pay 39% interest rate.
Double digits.
That's quite
it's not sustainable.
Let's look at what the government is trying to do to addressing the challenges of the health sector. In 2024, the Tinubu administration budgeted 1.3 trillion naira allocation to the 2024 budget. That's 5.03%. And this 2025 appropriation bill alone also has, a bit higher, 2.48 trillion naira. That's 5.8%, but definitely shortfall of the 15% of the Abuja Declaration. Remember the declaration in 2001 or 3, where African Union member countries came together and say you have to budget 15% of your appropriation to the healthcare system. So are there other ways? I don't know how you consider this. Is it enough, one, or are there other ways to secure funding to compensate for the shortfall for this to revitalize our health sector?
So the 15% is absolutely not enough because we're talking about 4 decades.
Even if 15% is not even enough. And we're not even paying up to that.
Absolutely. So let me give you another example. Washington, D.C. has a population of less than 1 million. 760,000 live in Washington, D.C. They have 7 great hospitals because what are they trying to do? Reduce the waiting time and the access patient-to-doctor ratio. So they voted to build the 8th hospital. Let's consider Lagos, where excess of 20 million, conservatively. How many tertiary care hospitals do we have? Not to talk about the human resources that will actually power that. So 15% is actually below. And when you present a budget as a National Assembly, it should be your priorities. So we need the federal government to actually show us that they prioritize health. A lot of our politicians, we don't need to mention them, they go abroad for healthcare services. Let's do that home.
Now, that takes me back again to the question I asked, the role of subnationals in all of this.
Yes.
Because you mentioned Washington, D.C. doing something. Now, as state governments, what can be done? I recall that I had an interview with a particular governor, and we're talking about looking at the situation of the primary health care in his state. And we mentioned a particular location where, in fact, doctors refused to go there.
That's right.
Because of the state of the road networks leading there. They talked about insecurity. They also talked about the fact that there is nothing in that hospital to work with. So what are the roles of subnationals now? How can they come in? Because the federal government alone cannot do this, obviously.
Excellent. And I'm not expecting the federal government to do it because there is no country in the world where only the government does it and it goes right. No. So let's talk about other stakeholders. So not being able to go to certain area for healthcare professionals is not unique to Nigeria. Baltimore City used to be very dangerous. We're talking about death rate, gunshots and everything. Johns Hopkins, one of the best hospitals in the world, complained that it's difficult for us to recruit doctors because they're concerned about their life. So what did the government do? They step in. The government is guaranteeing. Not only will I guarantee your insurance, I'll guarantee your safety. Incentivize them to come because we're human beings. So before I practice, I'm also concerned about my family. So let the stakeholders, not only the federal government, the local government to step in. My local government does not even know I'm a small business owner that has 15 employees. Not to talk of my state government. And I'm trying to expand. I went to my state, I purchased the land. I'm here to get the papers for that land.
How long have you been waiting for?
4 years. And let's talk about just the federal government. Yeah, the federal government can come back and even support more what the state or local government is doing. We give all our churches and religious organizations tax-free status. What are we doing about our healthcare facilities? So all we need to do is incentivize. If we do, we can start cutting back and start reducing the incentives that these doctors are getting from foreign countries.
Let's look on the brighter side. For instance, you were abroad. You went as an engineer, came back as a doctor. Quite interesting. But we have those who Nigeria has actually spent a lot of money on leaving Nigeria to for not medical tourism,
greener pastures.
Greener pastures.
Yes.
So. What are the benefits? Because some will argue that, yes, it's just an opportunity for us to have skill development and knowledge transfer. What can we benefit? How can we benefit from those that have left the country, practiced abroad, and bring back to this country, apart from the diaspora remittances that we're getting from them?
Fantastic. I'm a member of AMPA, American Nigerian Physician Association. This is an organization of over 2,000 Nigerian doctors living in the US. A lot of my colleagues, especially the older consultants, are looking to come home. But they want to be able to get proof that, look, things will be fine. Nobody is expecting the same status that we're living in the US. So we need a lot of incentives to bring us back. When you do that, you actually incentivize the private sector to do this. When these guys come home, they're the ones that become academic professors. They can train, so they can be bringing
But in
back.
specific terms, what are these incentives that can be put in place to attract these brains out of the country?
So one of it, for me, for example, the US government sponsored my medical education. What do I get in return? I stay there to practice, but they guarantee that my student loan will be paid at a particular interest rate. The interest rate is way lot below what you can get
This
outside.
administration has introduced student loan. Do you not feel that's another incentive?
It's not enough. We need to prioritize.
It has to be specific.
It has to be specific, and you let the healthcare sector know. If we have enough time, you know the trouble I'm going with my state here, with regulatory organizations, and so you really want to let the government, everybody know that, look, my healthcare doctors, my healthcare workers are my prized possession, and I need to get everything to incentivize them.
Let's take this personal a bit.
Yes.
You've been talking about the challenges you're going through with your state government, how it is you want to expand. Of course, what you are bringing to the state is something that will benefit the people of the state. And I'm wondering what these challenges are and how you've tried to engage the state government, perhaps, because for some persons like you, like in your association, this is not a good sign for them to return.
Absolutely. And they ask me, we talk to each other, and they're like, oh no, do I want to deal with that?
Right.
So the government may be saying, they say the right things out, but what are the actions on the ground?
Right.
4 years ago, I paid for land to expand. I have the receipts and everything. Nothing has been coming to me. And I keep going back. A lot of these foreign doctors, a lot of Nigerian doctors who are based abroad, they do not want to be engaged in all this white envelope, trying to beg people. Because yes, they believe they've done well, and they know the incentives over there. My local government...
And they know what they are offering.
They know what they're offering. My local government in Washington, D.C., for example, during COVID, were calling me when I was here, Dr. Abassi, do you need anything? Do you need anything? Right. My local government here doesn't even know I exist. I have 15 employees. Forget about me. I go back and forth every two weeks. So you can say I'm okay. What about my employees? So we cannot put everything
is that a gap, between in communication or a relationship between you yourself and your host? For instance, you've been there, you got the land, you did the paperwork. Is there something that you needed to do in order to get recognized?
They're requesting for something from you.
No, I'm waiting for that guidance. It's to your point.
I'm talking about you getting closer to, for instance, the traditional leaders, the local government chairman. What kind of relationship do you think you have with them to start with?
Absolutely, I don't have any relationship now, and I will tell you where I'm operating from. To open my 2 clinics in DC, I do not know the mayor. I don't have to know anybody.
But Nigeria has its peculiarities.
Exactly.
And that is it. That peculiarity is not working for us. And our leaders that are expecting us to stick with these peculiarities, when they go abroad, they're not experiencing anything.
So you're not ready to bend over backwards?
At all. Let's just make it uniform. If I have to know the local governor, if I have to know the traditional ruler, then what about the next doctor coming? If he's not a native of Lagos, does he have to go and start begging?
Does this have to do with inadequate data that we have? Because, for instance, if you talk about United States, United Kingdom, the West, they have adequate data and they have a plan mapped out. So is it due to the fact that we do not have enough data to work with?
Absolutely, because data is the new gold. We need to have the data to let us know that, oh, okay, this is a doctor who is coming home, who is providing this kind of care, and we lack this care, so this is somebody we need to help. Let's ask him, what are you going through? What are the things that can make you better? That's what the local governments over there are doing for us.
So these are the lessons we should learn from.
Absolutely.
So what are you doing in particular to keep your doctors back? Perhaps others could learn.
No, it's very tough. I keep talking to them. I keep looking at the brighter side. I tell them that, you know what, the stress here is different from the stress over there. And when you're here, you can also give back. Because I see that. I give lectures every day. I'm like, so let's think about that. It's not only about the dollars anymore. So you're trying to appeal.
What do you mean stress? Is it stress to treat patients?
Yes.
We have more sick persons here than over there. So then it's causing you to be stressed up. Is that what you're trying to say?
Yes, absolutely. And here, so you have to look at it. Over there in the US, our medical practice is collaborative. If you're a consultant, it's in your best interest to give me all the data. Here, we don't see that because you are the only one doing everything. You are the GP, you are the one trying to do the surgery and do all. No, over there is already structured. So when I'm calling you as a consultant, it's in your best interest because we all have the same goal. That patient needs to get better. So that collaborativeness, we don't have it here. And part of that is because of the shortage and because of our infrastructure.
So if we're looking at reforms, we've been talking about reforms, and all of that, pushing welfare, pushing everything that we can push, or doctors through the enemy are looking to push over the years. And it seems like they are hitting a brick wall. Talk to us from your perspective. If we are to begin from somewhere in specific terms, where should we begin?
So we need the federal government to have like a think tank. And the think tank should involve all stakeholders.
Who are these stakeholders?
The NMA will be members. Even citizens will be members. Because some of our elected officials do not know the waiting time that we all are spending at the hospital.
That's true.
So when they hear from their constituents, that may get them to wake up a little bit. That, look, this is what is going on. And then give them the data. How many lives are we losing? Because they may be in a vacuum. And at least they're acting as if they're in a vacuum. So give them the data. Let them actually see the raw numbers. Because what we're doing now is not going to cut it. And it's going to be another decade. We're going to sit here in 2030 talking about the same brain drain.
Are you saying that, for instance, we've got some people in the general hospital, someone who is already, been treated, referred to lose last tooth and all of that. And one of the challenges is for them to get certain drugs, especially even buying syringe, and they're even finding it difficult to even get the syringe. Are you saying that these politicians are not aware of this, little issues in some of these general? Honestly, well, getting a syringe, having your patient to buy syringe, is that the way it's supposed to be?
No.
So you're saying that they are not aware?
They're not aware.
How come they're not aware? This
Honestly,
is common knowledge.
And that is the way you have to look at it, because you and I have a lot of personal stories that you'll be like, they must be on a different planet. That how come this continues to go on? This has been going on for decades. If you go to LASU now, your waiting period is about 10 hours. That is if you're lucky. And you have to be calling everybody you know that knows a consultant. It shouldn't be like that.
So what are the implications, really? Because there's been talks about outbreaks, pandemics, and all of that might still hit the world. Let me not just say Nigeria, but the world as it is. And here we are grappling with a weak healthcare system.
That means we're going to be caught with, unprepared. And this time around, we may not be as lucky as we were with COVID. But let's even forget about the emergencies, because the international world tends to have their own surveillance system, and they might call our attention to something going on. Let's talk about what is affecting us locally. We are losing able-bodied men to cardiovascular issues, the likes of high blood pressure, diabetes, heart attack, stroke. We don't have the healthcare personnel to deal with them. Lagos State does not have any stroke center.
Really?
If I have stroke now, I should be attended to within 30 to 45 minutes.
Absolutely.
We don't have any in Lagos. Don't take my word for it. We're in Lagos.
This is not the first time you're raising this alarm. You've been saying this, and you're saying that they've not actually done anything to address this gap.
We are a medical desert. We're a pharmaceutical desert. So regardless of how good some of us may have financial wealth, if I have a stroke now, there's no place you can take me to.
So does that speak to our perhaps insincerity or laid-back attitude towards addressing these issues head on?
It speaks to our lack of priority. We're not prioritizing health. Honestly, we're ready to pray out of everything. Prayer is not going to cut this.
Well, let us take this a bit far beyond Nigerian, context. Yes, let's go to the United States. Trump is back.
Yes.
And we see how he's been signing executive orders and planning to deport immigrants. We saw the face-off between himself and the Colombian president saying that, no, if you want to deport our people, you have to do it properly. And now we saw in the news this morning that more than 3,690 Nigerians are due to be deported to Nigeria. Some of these might also include the Japa, doctors, so to speak. What impact do you think, you've been there,
yes.
How do you think this might affect them, those who are seeking greener pastures?
So let's don't look at Trump as just an isolation. They have a system there. If I'm a Japa doctor, a Japa Nigerian doctor, and my local government in Washington, D.C. realizes that I'm a licensed doctor, they're going to fight Trump on my behalf.
But they are picking some people randomly on the road. That's it.
So those are the ones on their own. But you're going to find out that any one of them that has access to a lawyer, which the Constitution guarantees you, by the way, they're not going to deport a doctor. Trump can tell you all whatever he wants. The American system is so designed that what they need, they're going to protect. And that's part of the priority. What they need, they're going to protect. It's the same Trump, before he got elected, that said everybody that comes to study in our country, as soon as they get a certificate, we give them a green card. You think he's stupid? No, he has stakeholders. He has the people that supported him, and they know what they need. Elon Musk is looking for talented Nigerians. You think he's going to
allow... That's another challenge to, what's it called, technology sector?
Absolutely. So we need to incentivize. The grass does not only have to be greener on the other side. We can provide the oxygen. We can provide the water. Those are the incentives.
Interesting. But
there's no place like home. A typical Nigerian doctor wants to be home.
Absolutely, absolutely. And like you have rightly pointed, all they need is being incentivized, and they would return wholeheartedly. But let's also look at what Trump also did in terms of suspending HIV funding for Nigeria now. And the burden of HIV in the country and how this has helped Nigeria over the years. What do you see? Even though there are those who talk about the fact that, well, he may not totally, put an end to that program because of the new Secretary of State who supports the program. But where do you see this going at the end of the day?
Let's assume he's successful in doing it. I hate that, but let's assume it goes ahead and it does that. It's a wake-up call for our government. One of the best things we got from the U.S. government was during Bush #2, the Bush son. It gave West Africa, or Africa as a whole, $16 billion grant towards HIV. That was the PEPFAR. So that's a long time ago. We should have been sustainable now. We should have been able to devise this, honestly. So we really need to prioritize it. We should not be waiting for the Western civilized countries to be supporting us, because their support is not guaranteed. So, for example, what Trump is about to do. So even if let's take this to be a wake-up call, because the next president may do worse.
So in all of this, how can, not looking at what we should do within our own country, just as you've been advocating, how can public-private partnership be leveraged, in this wise to revamp the primary healthcare sector to start with, given the success of initiatives like the Nigerian Private Sector Health Alliance?
We need the leadership. Everything starts with the leadership. Prioritize it in your budget. If you do that, somebody like me will not be facing a 39% interest rate. Honestly, let's start with that. When you do that, look, investors will come home. We have 230 million consumers. Investors will come home. Every time I fly down here, I see Lebanese, Indians, Chinese. What are they looking for?
Because the ground is greener for them.
It's greener for them. So
and it's easier for them here.
It's easier for them here.
Now, let's look at the gaps, those who are filling the gaps that we have talked about, traditional doctors and all of those. We've seen traditional birth attendants. We've just seen people grabbing one stick or the other, chewing one. Let me not point my fingers, but let me drop it now. But so many people have now started looking at natural ways of addressing illnesses. But that's also a concern, because the doctors, like you rightly pointed, are no longer as available as they are. How can Nigerians, or how do we, create a balance in such a way that people's lives are not endangered in the cause of seeking an alternative?
No, fantastic. And that, for us, should be an avenue that we think we have control over. We have a lot of natural practicing doctors. Yes, there's not enough research and development to make this area better. So a doctor like me will still be advocating for Western medicine because we have the data. Again, this is where the government can set priorities. That look, we can set out some money for research and development because yes, these things can get better over time. As I mentioned, 4 decades is when we've been losing our smart professionals. And now, are we going to address it now? The rot did not start yesterday. It started 40 years ago. So it's going to take a while for us, but we can start putting measures in place. Let's fund them. Let's fund the research and development for these local practitioners because eventually that may be our fallback. And a lot of men who are going to all these local, is because they don't have option. I gave an example. If you have to wait for 9 months to see a specialist, even your family members will tell you,
guaranteed. You're not guaranteed. You stay for that 9 months.
Yeah.
But these countries that are recruiting our doctors found them, quite attractive, taking them away from us. Should they? Because looking at what's it called, ethical considerations of this international recruitment, should they also bear some responsibilities for recruiting doctors from Nigeria, especially given the country's healthcare challenges that we've been talking about?
Whose ethics and whose morals are we defending? Talent will go wherever talent is being appreciated.
Right.
Even though we spent money to train this, to impart this knowledge in them.
I'm being honest with you. I gave you an example. I was not trained by Nigerian Medical Association. I was trained by American government. You think they like the fact that I come home?
No, you were trained by the government. You also gave back to the government. Yeah. But Nigeria actually, the federal government, introduced this proposal.
Have we put a structure, or should we put a structure in such a way that they can now give back to us because we train them like the US is doing?
Like the initiative, the bond doctor, what's it called? Proposal to bond doctors for 5 years, which actually faced criticism then.
That is it.
They didn't have to bond you, but then should Nigeria also look at
in that direction
ways of
so that is a losing battle. Honestly, let's use as examples. Talent goes wherever talent is being appreciated. There are some Nigerian doctors here that will tell you the only reason they want to go to UK, Canada, or US is for their kids. So this is more than just their own working condition. They're looking at their kids' school. So the government has to look holistic, the whole thing. Again, let's provide the oxygen, the water for our own grass. It gets better. And over time, we may be able to start correcting this. Trying to ban them is not going to work. Human beings. It's not. We're migratory by nature. And talent will go wherever talent is being appreciated.
I like that line. Talent will go wherever talent is appreciated. So it's high time government begin to look at how it can appreciate the talent left as it is right now, giving them the incentives they need. Dr. Rasheed Abassi, Chief Medical Director, Heritage Clinic, thank you so much for your time on the program.